It's estimated that upwards of 80% of people are not honest with their doctors about their health. You can chalk a lot of this up to good old-fashioned embarrassment. Well, we asked our guest doctors on today's show to share some patient stories so you don't feel alone.
So many patients come in asking me embarrassing or personal questions specifically about their buttock, breast, moles, sagging skin, issues with their genital area. So going to a dermatologist or a plastic surgeon is very personal, and you will be surprised at how many amazing, embarrassing questions I get.
One condition that people ask me, particularly men, is that can COVID-19 be associated with a decrease in sexual drive? And unfortunately, studies are starting to show that yes, that could be. There's a decrease in not only the ability to achieve a erection, but also a decrease in the number of cells that produce testosterone and things that lead to your sexual drive.
Here's an embarrassing question that a patient brought up to me just the other day. She said, during sexual activity, a ton of urine leaked out of my vagina. Why is that happening? What do I do about it? My boyfriend made me feel really badly about it. And the reason that happens is one of two things. One is called coital incontinence, which is leakage of urine that can occur during sexual activity. The other is called female ejaculation, which is release of fluid during sexual activity. Both can be embarrassing, but both are entirely normal.
Dr. Judy joins us to break down what's behind this health humiliation and how to conquer it. Hey, Dr. Judy, let's jump right into it. What is the major driver of patient embarrassment?
Different studies show that people are just not transparent when they're faced with embarrassing situations because they want to be avoiding getting judged by people, lectured about how bad certain behaviors are, especially when it comes from doctors or authority figures. They just don't want to have to overly explain themselves. The majority are just simply too embarrassed to tell the truth.
Some patients, Dr. Judy, even experience shame when it comes to their health issues of all things.
That's right. And this shame can lead to major anxiety. There was a survey that found that people are too embarrassed to go to the doctor because they're just afraid of what they might find. They don't really want to know the truth. And yet that unknown actually causes even more anxiety. That fear of the unknown can cause you to go down a total shame spiral. You're Googling and WebMDing and not even getting accurate information. So people really need to feel like they have somewhere to turn when dealing with embarrassing health conditions without putting their pride on the line.
The good news is this. There is technology that lets patients get the care they need remotely, and they can escape the embarrassment that can come with going to a doctor's visit and talking about it.
If you're too embarrassed to go to the doctor's office or pharmacy, simply go to Exuma Wellness for a virtual consultation, and they diagnose you right over the computer. It's as simple as filling out a questionnaire and uploading photos. Then you get to talk to a board-certified physician who will treat you and have prescriptions sent directly to your home. It's great because you can get erectile dysfunction medications as well as hair loss and acne treatments. The whole process is quick, simple, and safe.
Yeah, that's a good thing because we want people not to ignore particular health issues because they're embarrassed. We want to get them to talk to their doctor and get treatment as soon as possible. Dr. Judy, as always, you're a bright light, and thank you for all your great insight.
Thank you so much, Dr. Ian, and thank you, Dr. Orden.
My pleasure, Judy.
To learn more about Exuma Wellness, just visit getexuma.com or visit our website, thedoctorstv.com.